Hi, everybody. Can you guys hear me? Is that okay? Good. My name is Margie Hunt, and I work with our national partnerships at Casey Family Programs, and just excited to be here with everybody. And I'm moderating. I learned that I was moderating a day ago, so I'm just going to moderate. But we have wonderful people with us, and thank you guys for joining the session. What I thought we could do, just so people know who's in the room, if that's okay, if people can just go around and say who you are, where you're from, and then we'll have an idea, and then we'll turn it over to our folks who are presenting on the national level. Is that okay? So do you mind starting?
Sure. I'm Casey Calmusa. I do communications with Casey Family Programs.
Thank you.
Hi, good afternoon. My name is Katie Thompson. I'm with the Salish Kootenai Tribe in Montana, and I'm the foster care program manager. Thank you.
Hi, my name is Celeste Minadaluk, and I live in Golovin, but I am the terrible family specialist, but I also help with diagnosing cases in Alaska.
In Alaska. Okay. Great.
Good afternoon. My name is Carla Neafa, and I am a tribal family specialist. I work for Claire. I live in Shishmaruk, Alaska.
Alaska. Okay. Thank you.
My name's Jason Walton. Work with child social services at Fort Hall.
Thank you. Can I come over here to this table?
Okay. I'm Carol Fuscoy from Alaska. I work with CORG and Children and Family Services, one of the programs I manage.
Great. Thank you.
Good afternoon. I'm Mary David, and I'm also with Clerk Incorporated in Arizona.
Thank you.
Hi, I'm Tanya Dumas. I'm with Casey Family Programs, and I'm on the Indian Tribal Affairs.
I'm Julie Bennett. I'm a contractor with the Children's Bureau office here in Seattle, Region 10.
Good.
And I see the stars.
Welcome.
Joanna Farmer, I'm the Twahi Program Manager for the Possibly Off the Chart.
Can I come over here? Yeah.
Deputy Administrator from Montana.
Oh, great.
Robin Graham from Montana as well.
Good afternoon, Alicia Macias, Traditional Engagement at Casey.
Brandon Gonzalez from Portambos College Pride.
Great. Thank you.
Ethan O'Toole, San Diego. Travel.
Thank you.
Christy Blunt, Cherokee Nation, Oklahoma.
Welcome.
Jeff Garcia, Casey Family Programs, New Mexico, Arizona.
Thanks.
Stephanie Ellis from the Spirit Creek Nation, Oklahoma.
Great. Welcome.
Sam Halloran with the state of Alaska.
Thanks.
Angelina Callis, and I'm representing Sachanta Child and Family Services, Rosewood Sioux Tribe.
Welcome.
Dalen Lisa Head, Confederated Salish Kootenai Tribes.
Thanks. And I know people join us.
Barbara Dude with Tlingit and Haida in Juneau, Alaska.
Rachel Hibb with the Alaska Center for Resource Families.
Thanks. Take care.
Carl Schroeder, California Alliance of Child and Family Services.
Great. Thank you. And did you say who you were? Or? No.
sorry.
No,
I'm
that's
Erin Wilkinson from Salt River Pima Maricopa Indian Community.
great. Thank you. And thanks so much for being in here. And it's nice to, when you see the depth of people we have in this room, and we're going to talk about some of the work of our national partnerships and what they might be able to provide or support, information that they've been working on for a couple years, different areas. We have Stephanie Sproul from Children's Defense Fund. We have Anna Beltrain from Generations United, and Teresa Raphael from the Alliance for Strong Family. Another alliance, the Alliance for Prevention and Support Family Trust Funds. So those are our national partnerships, but I think so much from what we learn from our national partnerships and locally is the depth of we're all learning in this room. I just put it out there around Family First. So what I wanted to start with is we're going to turn to you, Anna, and then hopefully we'll have a little time at the end, or if people have questions, we'll go, they have slides and information, but don't hesitate to ask questions and stuff. Like we can manage that. I'll keep us moving and on time, but it's good to have interaction if that's okay.
Absolutely. Ask
Okay.
questions at any point in time. I'm going to start us off with just kind of Generations United and what we do and how perhaps we can intersect and help each other and consider us, please, a resource. We are a national nonprofit located in Washington, D.C., although I work out of my home about 20 minutes away. It was a very nice commute this morning. And we do a number of things. We've had a national center on grand families for 20 years this year. I've been with them for almost all of the 20 years, shy about 4 months. And we do a number of things at the national center, including all these things listed here. So we have lots of materials. We have a caregiver network that I'm going to tell you a little bit about. We have a couple of websites we maintain with partners. We provide technical assistance to states, and we have a TA menu through Margie's group that we can share with anyone who's interested. So a number of things, right? And we talk to the press all the time and really try to elevate the strengths and challenges of kinship caregivers. So that's kind of who we are. I know we're kind of not a household name, but we've been around for a long time. And in terms of our latest and greatest achievement, the Grandparents Raising Grandchildren Act was just passed and just signed into law today. I just got an email this morning. And that will create a federal task force of all the federal agencies. So you know how kinship care is just a little over here, a little over there, lots of silos. So the idea behind this is to get them all talking, and how can we support kinship families better? And there will be some kinship families on that task force. So one of the big projects that we've had, and hopefully this is an area where we can be of some help. It is not quite clear yet, based on what Commissioner Milner said this morning. I'm a little confused. You all may be too. But by October 1st of this year, and it sounded like they were on time with this, they have to identify a model of family foster home licensing standards. Now, what Congress intended was that they point to this model that Generations United, the National Association of Regulatory Administration, the American Bar Association, and the Annie E. Casey Foundation developed together. It was a multi-year project. I'm going to share it with you. It was not named in the Family First, so HHS has some flexibility here. We are very much hoping they point to this model, because this model was developed to address those barriers that relatives face in that pre-licensing process. So all our model standards address is how to get licensed, not how to get reapproved, how to maintain your paperwork, how to take care of the children, just that place where relatives encounter barriers. So we're very much hoping they point to our model, because each state is going to have to report back to HHS by April of next year on this whole laundry list of things, looking at whatever model they point to. If they point to us, we are going to be right there, ready to help you all. We've helped a number of states already. But states are to report on what their barriers are in their existing licensing standards, because we know relatives face many, and how they can compare and align with another model, and then how they use that waiver authority that the feds give them. So under federal law, states can waive any non-safety licensing standards for relatives. And states get to define how they define safety and non-safety. So there's a lot of flexibility there, which a lot of jurisdictions aren't taking advantage of. Yeah.
I just have a quick question about, so I know for tribes that have state tribal agreements and 4E agreements, like this would be something they could recommend you to the state. But for tribes who are direct 4E or are not, but also don't have a state tribal agreement, do you provide TA to them as well, or could you help us find access to?
Good question. So NICWA, who is a partner of ours, we work closely with them on a number of things, and NICWA has some model standards out there. So we point to the NICWA standards for tribes, but ours could be used as well. So you could look at both. Again, it's going to depend on what HHS says, but they're both relevant. And also on that note, there are a separate set of standards for therapeutic foster homes, and they're right now in the process of making them more kin-friendly, and we're having some input on that. So, kinship is being more and more acknowledged as a real answer for a lot of what ails the child welfare system. But we need to make sure it's done right, and we're here to help in any way we can. So this is the national model standards that we developed. It's got all these things in it, including a crosswalk, and we have it in a Word version too, where you can just plug in your standards, compare them to our standards, and figure out what needs to be changed. So for example, our model standards don't have any square footage requirements. They don't require people to own a car or own a home or speak English or have a high school degree or not have a pit bull. All these kinds of things we find in state standards, and that is totally up to them to develop. The feds say very little about licensing standards, so this is all self-inflicted pain, right? And so this is a way kind of to address those concerns and really look at, hey, maybe that doesn't make sense. And, I encourage y'all to get working groups going early, even before that October 1 deadline, and start looking at your standards and maybe figuring out what the barriers are in your jurisdiction. Because, for instance, I had a conference call with a southwestern state, and we got on the call thinking, I was told the barriers for kin were criminal background checks. Because what the feds say is you have to have this Adam Walsh federal criminal background check, and their barrier crimes make a lot of sense. They're violent felonies. But what states do is often go way beyond that and bar applicants from being foster parents, relatives or non-relatives, for life for things like writing a bad check 20 years ago. So, just kind of crazy stuff that does not have to be there. So anyway, I got on this call thinking that was it, and that's what I was told it was. And then we started talking, and it turned out it wasn't. It was immigration standards, which were just in that state and were causing a barrier to kin. So sometimes just getting all the right people in the room at your state and figuring out what's unique to you and what is causing the problems to you as a first step, even before HHS points to a model, could be really useful and get you off the ground, because you are going to have a tight timeline to respond by April 1st of next year. And again, we're happy to be any kind of resource to you that we can be. So, as I said, we're very proud of these standards. They just concern that pre-licensing period. And they're flexible, just like Commissioner Milner. That's really what we strove for, and based on community standards, but really a complete set of safety. It's all safety, because we really feel like there should be nothing non-safety. I mean, what's the point of that, right? So we don't have waivers and variances, so it makes it pretty easy for states. There's a lot of room there for keeping sibling groups together, for doing things that make sense for that family in that community in those situations. That's the licensing standard. Does anybody have any questions about that? I'm happy to answer anything offline too, and my email's at the end. But another resource I want to tell you about, and this may be an easier place to intersect with you all, is that we have this Grand Voices Network. And we've developed it with Casey Family Programs, and now we have some additional support from the W.K. Kellogg Foundation. So we've expanded it to include a number of Native American caregivers and African American caregivers as well, really targeted on that racial inequity amongst those two populations. So we are now in 42 states and 12 tribes. Please don't ask me to list them, but I can tell you what the states are that aren't included. And if you have a caregiver that you think would be a great national advocate for themselves and for other families like them, because as you heard from this morning, just the power of constituent voices, which is what Teresa's going to talk to you about too, is just so powerful. Just that's really what gets the needle moving. We know it. Every time we go up to talk to any kind of policymaker, that's what they want to hear. They want to hear the stories, the real challenges, the real strengths. So that's what this is. It's organized through Margie's group. Let us know if we can connect you and be of any help on that. And let us know if you're from one of those states and have somebody in mind. We'd love to hear about it. A third tool I'm going to tell you about is this WikiHow for Kinship Foster Care. So this is a tool we developed with Child Focus, which is a for-profit consulting outfit, and the American Bar Association. And the three of us got in the room, and we invited a number of states to a big convening in, no tribes, I'm afraid, but to a big convening in D.C., but a number of states with important tribal constituencies. And talked about what really does it take to be a Kin First child welfare agency. And we narrowed it down to these 7 steps, and that's why we call it a WikiHow, like the WikiHows on the internet. So this is just supposed to be really simple. But then under each of these steps, we have tools from jurisdictions around the country that could be useful, so that you all don't have to reinvent the wheel if there's something in particular that you're struggling with. And this is another area where Family First really gives us an opportunity in the kinship realm to look at everything we do kinship related holistically and really start from the beginning and how can we make this better. The kinship navigator piece is step 7, really having that community network and building it out with other organizations that are already doing the work. Step 5 is the model licensing, which I just talked about. So there are lots of tools there. All these resources are on grandfamilies.org. They're all free. Reach out to me anytime. We're a nonprofit. We're here to help. This is where we house all of this stuff, grandfamilies.org. It's a website that, again, we launched with Casey Family Support in partnership and with the American Bar Association. And it's not just our stuff that's on there. The program instruction for the Kinship Navigator funds for this year are on there. And Children's Defense Fund resources are on there. Basically, anybody who does anything kinship related, we try to get it on there. The Joseph Crumbly videos, whatever you can think of, it's there. It's a resource. Please use it. And these are just specific links, which I will leave you with, and you can look at, because I believe you're getting all these slides, right? Yeah. I'll just elevate those state fact sheets. We have a fact sheet for each state and the District of Columbia that we developed with Casey, with CDF, with a number of partners, and we really try to identify community-based kinship navigator programs in that specific state that help the families directly. If you know of a program that's not in one of those, just reach out and I will make sure and include it. I can get that turned around pretty quickly. And then finally, my email address, my phone number, and my partner in crime's email address and phone number. So don't hesitate to reach out to us. I'm going to turn it over to the next big source of resources. Thank you all. And do let me know if I.
Thank you. My name is Stephanie Sprout. I'm the Deputy Director of Child Welfare and Mental Health at the Children's Defense Fund. We're a national nonprofit that work on a variety of children issues. Child health, poverty, early childhood education, but I work on our issues related to child welfare and kin. And so CDF, we have a number of helpful resources and tools related to Family First. I'm not going to review them now, and I apologize, I don't have a PowerPoint. But I did want to mention that while actually one of our resources are in the handouts that was passed out by Casey, the implementation timeline of Family First. So I encourage folks to go on our website and look at some of our other materials we have on Family First, including a really detailed 12-page, 13-page document that goes through every single provision of Family First, in case that's helpful. But I really wanted to spend time this afternoon walking through what we think is really helpful as states and tribes are starting to, or hopefully not starting to, but as they're underway going with their planning and preparing for the new reforms in Family First. Especially how it relates to utilizing and maximizing your partners within the state and other ongoing initiatives in the state. And I think, and again, I keep pointing to the slide that's not there, the 4 different, I would say, connecting points or framework that we've been thinking about as most helpful for states as they're trying to think about how to maximize their scope and reach. Because again, we know that everyone who is involved in child welfare is extremely stretched thin in all your different responsibilities, and how helpful it is to really be thinking critically about how to engage other partners in other public sectors to, one, be expanding the reach and scope of Family First, but also maximizing our brain power and trying to figure out how we can be really making Family First successful and how we can really be impacting these children and families. And so the 4 areas that I was thinking about was really looking at existing initiatives in your state that relate to child welfare, and I'll come back to all of these in more detail. The second is connecting and partnering with other systems like public health and mental health and substance abuse. Third is partnering with other stakeholders with a similar vested interest in these children and families. And then fourth, but certainly not least, connecting with the families themselves and the constituents themselves who will be impacted by Family First. So that really are the birth families, the kinship families, the adoptive families, the kids themselves who are in the system, or the alumni of the system, because we really need all of those voices at the table. So I want to start just spending a few minutes or a few minutes on that first piece about connecting to existing initiatives in your state. We know that Family First is not the only priority that you all are working on, and that many of you have ongoing initiatives or task force within your states related to child welfare or to other issues related to vulnerable children and families, and how important it is to really think about, are there connections that can be made with those ongoing work groups that could work really well and tie really well with Family First? Family First, there are, dozens and dozens of different provisions that impact different people and parts of the system, and I think it'd be really helpful for people to sit down and look at what other areas in your state has already been starting to focus on. For example, some things that I was thinking about are there certain initiatives underway for pregnant and parenting teens in your system that you could be looking at and connecting some of the dots there? There was a big push back in 2014 around some other federal child welfare legislation around preventing victims of sex trafficking in the child welfare system. So again, is there something going on in your state around that can be connected, especially as we're looking at some of the changes in group care? Special task force that look at some of the unique needs of older youth who are in care. I think similarly, many states have either working groups or units that focus on kinship families and making sure that you are in alignment with some of those issues that are trying to move forward in your state. One piece that CDF and Generations United works on is around states' use of the Title IV Guardianship Assistance Program. I know many of the states who are in this room have that program. It's an optional federal program. Right now, I think there are 31 states in DC that have it. But again, there are a number of initiatives right now in states trying to look at how to better maximize Title IV gap. And again, that really aligns nicely with Family First and how we can be better utilizing families and kin. And then certainly, I think we all understand the big connection with Family First in the response to the opioid crisis. And I know many states have many different ongoing initiatives around that, many of which are outside the child welfare system. But I think it's really important for this, especially given the connection with the prevention services, to be bringing those folks into the table and making sure that there is anywhere that you could be overlapping some of that work to help move forward. The other initiative that I wanted to mention to folks is a new campaign called CHAMPS, which is the Children Need Amazing Parents. And this is a national campaign that is really designed to promoting quality foster parenting, or quality parenting more broadly, not just for foster parents, but for birth parents and for kin. And this was an initiative that was launched a little over a year ago by the Annie E. Casey Foundation and several other foundations, the Hilton Foundation, the Duke Endowment, with the goal of really creating policy reforms in 20 to 25 states that help with the recruitment and retaining of quality foster parents. We think that campaign works beautifully with Family First. We know that I think one of the things that we're struggling with Family First is this shift from going from group care and stepping children down into these family-like settings. And we've heard from numerous states how, while they agree with that and they're very excited about that movement and they've been going in that direction, that in many states there is a very serious challenge with trying to find enough foster homes. And the CHAMPS campaign, I think, could be a really interesting initiative for your states to look at and see how you can be maximizing their resources to help identify foster parents. And I just realized, actually, we have 4 handouts on CHAMPS. Could Anna or Margie mind passing some of those out, including two documents that really highlight how Family First and CHAMPS works well together. CHAMPS right now is going on in 8 states. I think the only state that's in here that I heard was in Washington. But again, I would really encourage folks to go to www.fosteringchamps.org to learn a bit more and see how you can engage your state around this campaign, because I think this is a really critical connection for people to be making. Okay, so then going back to the 4 different buckets, the second bucket is really around working with partnership with different systems. So while Family First is directly related and under the responsibility of the child welfare system, this law has a lot of opportunities for other public systems within your state. And I think probably more so than we've seen with other child welfare laws or other federal programs. And so we're always talking about, knocking down silos and bridging, between the different systems. And I really think Family First is like our big opportunity to be going to some of these other systems and bringing them to the table. I think obviously as a first step is, educating your other partners in the different systems on Family First and making sure you highlight some of the relevant provisions that have a hook for them and trying to connect the dots for them about why they should care about Family First and how this helps them fill some of the gaps in some of their services. Certainly, there's a strong hook with the public health field on Family First. I think it's critical to be engaging your Medicaid partners and making sure they're at the table when you're having these conversations around Family First. I think it'd be wonderful for people to be looking at what programs and treatment services are currently being used in your state by Medicaid relevant to mental health and substance abuse. How is Medicaid paying for those? Are there holes that the Medicaid agency has identified that maybe Family First can now step in and fill? I think there's been a lot of discussion about how do we braid our new Title IV prevention service dollars with these Medicaid dollars, and we're still trying to untangle that at the national level, but I think what has been really helpful for me as I've been meeting with different Medicaid and health experts is trying to first identify what are programs and services currently being used in your state, are any of them evidence-based? And then from there, are there other wraparound services or other programs that Family First can now be stepping in and helping these families? I think it'd be important to talk to your Medicaid staff about how they're using EPSDT for parents who are suffering with maternal depression. And are some of those families in need through that? Could those be also serviced through Family First now? I think it's also very important to be engaging your partners within the juvenile justice system for a couple of reasons. Some states, not every state, but some states are using Title IV dollars for children who are in juvenile justice facilities, those who have been stepped down from detention centers, or those who are in other, who are being diverted from some of those facilities. And under Family First, they will likely be losing funding for those different programs. So I think it's really critical to have those partners at the table as you're talking about these new changes. I also think it's important to be engaged in the juvenile justice community because they have actually been very progressive in pioneering other evidence-based programs. A lot of the programs that we use in child welfare actually grew out of the JJ system. And so learning from them about other programs and prevention services that they have been using that have been found effective for this population. I think the last group that I would highlight is your partners within the housing and homeless community. And this might be a bit of a stretch, but we're trying to be creative in how we can maximize Family First and Title IV dollars. But for example, permanent supportive housing is an evidence-based, trauma-informed model that is being used in some communities to stabilize homeless families with intensive trauma-informed care that addresses mental health and substance abuse challenges as it relates to keeping kids from entering foster care. So again, I think we should be thinking about are there some other hooks that maybe aren't necessarily within the child welfare, direct agency that we could be spreading and expanding a bit more to. Sorry, yes, that's the permanent supportive housing. So we're always creative at CDF trying to maximize how we can use federal dollars. So I think with a lot of these programs, technically the programs can live in different agencies, but child welfare would be the one administering the dollars to those agencies. I think we would need some clarification from HHS on how that would work. But I think when you're looking at some of the mental health and substance abuse programs that right now are maybe you're housed under Medicaid or some other public health system, I think we could be using those very similarly. So then this third group was around partnerships with other stakeholders who are equally vested in these same types of families. Several states have already started these family first working groups or caucuses that are bringing, people around the table to really be walking through each of these provisions and walking through, kind of where we are and how far we need to go. And I really encourage every single state to be using that model. I know Oregon has a really wonderful, is anyone from Oregon in here? Oregon has a really wonderful model, and actually they have a website where they list everyone who is a part of this working group, and it's like 100+ people who are in this working group, many of which are actually state legislators. Sarah Gelser, who is the Oregon state senator in charge of the Senate Human Services Committee, actually was the one who convened the working group. And so I really encourage people to be thinking about who within your state legislators might be someone who you think might want to champion this, who might want to push this, because you're going to need those folks at the table for some of these budget conversations. And so making sure that they're at the table too while you're trying to figure out how we can be moving these pieces forward. Certainly, I think having a wide variety of different people within the child welfare system at the table, people who are doing the frontline, casework, people who are working on the data, the people who work in finance, the Chafee specialists, the people who are adoption specialists, kinship specialists. We really need to make sure that every single person who has some type of narrow focus or perspective on the system is at the table to help us figure out where there are some holes and where there are some strengths that we could be working on to make sure that Family First is successful. We think it's critical that we have the judges and the courts at these tables. The judges have a really important part to making sure that these are being implemented correctly, that there are reasonable efforts being made to keep kids with their families, and that they're not going into group care inappropriately. So we need to make sure that judges are aware of these changes, that they're training their staff to be aware of these changes. There also is some changes made to the court improvement program under Family First, so making sure, again, that judges have their voice at the table. Guardian ad litems, CASAs. Question over here?
I didn't mean to interrupt.
Oh, no.
I just wanted to thank you for bringing the courts into and at the table, and wanted to share an initiative in Mississippi that I just
Oh, great.
found out yesterday, and it's through the auspices of the Supreme Court and the Children's Commission under the Supreme Court, and they have assigned 6 pilot counties, each led by judges, to convene the multidisciplinary partners to look at gaps in certain services. And this is handy because judges hear what those gaps in services are. So they are in the design phase, and I'd be glad to keep whoever is channeling this
That-
information up on how that's being done. But if it's successful, then they'll spread it all over the state. And as you know, Mississippi has a lot of rural counties where services are hard to access. So we're looking at this as a model perhaps for the judges in other states to convene these groups. Because as you know, you get a letter from the Supreme Court, or if you get a letter from the judge, then people are likely to attend.
That's fantastic.
But Alabama has been doing some similar work as well. You may have the neighboring state. A lot of judges with the child welfare system to do good things.
Yeah, and I think it's really important to have them at the table too. We heard in, I think it was North Carolina, one of the requirements under Family First for the group care setting for the QRTP is that if a child is there after 6 months, they have to go in front of a judge as a way to, I think, to make sure and pressure states that they're not just keeping these kids long-term in these settings. But again, we're hearing from these counties where it's very rural and those judges meet very infrequently, and how that 6-month piece could be very challenging. And that's why they need to be at the table to make sure that they are staffed properly, that they know about all these different requirements and all these new pressures that are going to be placed on those systems as well. And then obviously private providers, the group care providers, and then certainly child welfare advocates, the folks in the state who are really going to be making sure that people are aware and educated about these different changes. That's the last one, so we're almost there. I think the only other piece I would add to, and I know I've heard some other folks mentioning this today, is but how we can be engaging researchers and universities to be really stepping in and helping pull some of the slack on some of these kind of complicated and wonky pieces with these evidence-based programs. There's a really big evaluation piece on the prevention programs, and that's something that I think is complicated and hard for a lot of our child welfare systems to wrap their heads around. And so really partnering with some of those experts who can do that and help us with those pieces is so critical. And I know Peter Pecora has been mentioning that too. And then so lastly is, how we can be partnering with the constituents and families themselves. Certainly, Family First would not have happened without the voices of the young people themselves who are in the system, with the families who are in the systems, with the relatives who are in the system, and we need to make sure that their voices continue to be at the table as now states are starting to roll out and implement these changes. There are a number of phenomenal national and state alumni networks, and I encourage folks to look into that and see who is in your state that might want to engage on this. At the national level, there is a National Shadow Day we do every May in DC, and it's hosted by the Foster Care Caucus, where you have a young person who is in the foster care system or who was in the foster care system shadow for a day a legislator. And that has been found to be extremely helpful in getting them to really understand these issues and some of the challenges facing these children in the system. And I think it'd be a wonderful idea for people to be thinking about that within their own state legislator and helping people get more interested and invested in this and why you need more funding or budgeting for some of those services. And I know there's certainly a hook with some of the birth families. Do you want to? Perfect, great. And the kin piece, which obviously we need relatives at the table too, since there's such a big part of Family First that's helping relatives and families. So I think before I turn it over to Teresa, I'm just curious, how many folks within your state are starting these type of working groups where you are bringing together a variety of stakeholders? What state are you from? South Dakota? No, that's great. No, I really would hope that every state really considers this very thoughtfully because it's extremely helpful. I mentioned Oregon, but Colorado's doing something similar. We've heard things in Florida and Nebraska, I think.
I would say, I know many people here are also representing tribes, and so if we know that things are going on, or your questions are what's going on in the state, that's something that Anita and her team and our strategic consultants can help think through too, because as those groups are setting up, as you're hearing, we're kind of pushing these groups to start, and I know there's stuff that's already happening. We want to make sure that when we talk about everybody being at the table, how do we ensure that, particularly states that tribes that don't have 4-H, we've heard, and they can, how do we make sure that those funds are flowing where they need to be flowing? And that is around what's happening in your tribes, your tribal communities, to make sure that we're getting that information, and being that person to help connect with yourselves. If it's not already happening, where can we push harder? So I just put that out because I know we're talking about essentially states and state work, but we're also, I know that we're also having people here representing tribes, and so where we can think about helping to support or encouraging those connections, let us know. So that's for our team, Anita's team, whomever at Casey, let us know and we'll help work that through. And I know the tribes that are here are working directly with their ICLA folks, so again, let us know. Just want to put that out there.
Great, thank you. Thank you.
I'm just going to set this up for Teresa.
While Anna's doing that, I'm just curious, how many people here know about the Children's Trust or Prevention Fund in your state? Do you have any connection? Oh, right, we got New Mexico. Yeah. Any others? Yes, like the Alaska Children's Trust. Do you guys work with them? I'm Teresa Raffel, and I'm the executive director, as Margie said, of the National Alliance of Children's Trust and Prevention Funds. And one of the things I want to make sure you leave here with today is an awareness that in your state, you probably have a children's trust fund that could be a really good partner for you. To explore, particularly around Family First and the prevention components, to explore where you might come together. The Children's Trust Funds, the first one was created in 1980, and so they have a long history of working. As the prevention field has grown, they've grown. Many of them are, let's see, on it. Oh, I'll just... I'll do that. Many of them are also the state CBCAP, Community-Based Child Abuse Prevention. Do you guys know about that, the CBCAP funds? They're the federal dollars, the first ones, and they're still going out, that are dedicated entirely to prevention. It's not a lot. It's about $40 million a year, but every state gets them, and every governor designates a lead agency. And those folks have been grappling with the issues around evidence-based work and prevention for more than a decade. They had requirements they have to meet. They have to define what's the evidence behind the programs they fund. They don't implement programs, but they fund them. That $40 million mostly goes to communities. Collectively, the trust funds put out about $200 million. And when I saw the states represented here at this meeting, I just sent an email to those trust fund directors in your states and said, can you tell me what you're doing with tribes in your state? Because I know that's a big priority for them. And quite a bit is going on in terms of home visiting programs where there might be a great fit with the Family First Prevention funding. Also some community awareness around child abuse prevention, some parent education work, some of the kinds of programs that you might be looking at for those in-home services for children and families under Family First. I just have to introduce one of the real pioneers in this work to you. Melissa, I'm going to call on you. And Melissa Brodowski, if you would raise your hand. Melissa was the one at the federal level in the Office of Child Abuse and Neglect leading those early discussions around what is evidence, what kind of programs have evidence, and how will we define that in our reports. So Melissa would be a great resource if you want to talk further. We would certainly be happy to talk further about that. The trust funds are diverse. They probably look different in every state. Some are smaller with only a few $100,000. The largest one has about 18 million. And that would be Massachusetts, with a lot of that money going to home visiting. I really appreciated what you were saying, Stephanie, about all the partnerships, all the different groups to pull into this work. For many years, the trust funds have seen themselves as a hub around prevention to connect with all of those same folks. And one of the benefits is that some of the funding they have, they call it glue money, because they can sponsor a meeting or a professional development session or a state conference, and they can help bring those folks together to have the kind of conversations that you want to be part of and you want to have them be part of for you. So just a few resources that we provide through the trust funds, but also to anyone else who's interested. And one of those is around helping families build protective factors. We realized a long time ago that helping to strengthen families means giving them tools that they can use long after we're out of their lives. How many people here have heard about the Strengthening Families Protective Factor Framework? Is that a new or a familiar idea? We have some online training that workers are using. Parents can use it too. It's free of charge unless you want CEUs, and then there's a very small charge that we have to pay for those. But you can access all of these things I'll tell you about via our website. I encourage you to think about that as you're able to move into more prevention work with families. We've done a lot of work looking at preventing child neglect, and our approach is that child neglect is not just a family issue, it's a community and societal issue. And so helping families understand that they can access resources, helping communities understand the importance of those resources has been a really important piece, and we have a lot of materials there, including an online training which you can access. One of the most important pieces I wanted to share with you, and I think highly relevant to the work with Family First, is that of engaging parents birth parents who have experience in the system and who can help provide guidance, just as we heard with the panel this morning, the kinship care providers, and Shauna, the birth parent who spoke, and also the young woman who had been in foster care herself. The expertise that those folks bring is it's critical, and nothing else will match it. And so we've been very fortunate to be able to develop a birth parent national network. And we hope, can I ask, has anyone ever heard of that? I love your hand going up back there, thank you. It's a few years old. We have over 200 members, and organizations can join as well as birth parents. And it's a great opportunity for you. There's no charge to join. We ask people to fill out a small registration form just so we'll know who they are and a little bit about them. They meet every other month by webinar, we do. And we provide a lot of training and a lot of support and a lot of opportunity. So, for example, through our partnership with Casey Family Programs, the Casey policy staff come on to every webinar, and sometimes we hold special ones around certain issues. And they provide a lot of training around, for example, what is family first? Since 2016, we've been talking about that. Parents have been making their voices heard by going to DC to testify, by talking to their state policymakers and officials, by writing letters, and by putting out publications. So I'll just show you quickly, we have a number of publications on our website that were written by parents. We help edit and help put things together and make it easier, but we don't shape the wording. It really is capturing the thoughts and words of parents to make this available to you, to policymakers, to other parents who may feel really happy to know they're not alone in some of the ways they're thinking about policies. And then we are continuing to do regular publications and new materials that will come out. We're very fortunate to have the ear of the Casey Family Programs leadership, and so sometimes Dr. Sanders will say, I'm curious what you think about X or Y. And then they'll work for a few months to come to some consensus, to put their thoughts together, to look at what the research says, and then to come back with something. Many other organizations around the country and in states have taken advantage of that group, and I really encourage you to as well. So, for example, the American Academy of Pediatrics was working on some new policies, and they wanted to hear from parents. And so we were able to help make those linkages. The American Bar Association recently reached out, and some of the parents we're working with connected with them. So there are two benefits that you might think of with this group. One is if there are any parents that you're working with now or that you do start working with, we hope you'll have them share information with them about the Birth Parent National Network and encourage them to join. They'll connect to peers around the country, and they'll get a lot of good training and support. And the other thing is, if you are working on some guidelines and you don't have parents that you're already working with, but you'd like to get a parent perspective, then we would be really happy to work with you on that. We also work with some local jurisdictions to help them put together their own parent advisory committee. And that's been really successful. So we have a body of materials, we have things to think about, we have a structure and a process that we're happy to share and help you work with so that you can create your own group of parents who can advise you, be your partners, and help you navigate as this work moves forward. So again, just more materials, a flyer about the Birth Parent National Network, and we will have one posted on the electronic site for this meeting so you can download it later and share it with anyone in your community. We have a virtual convening. We really wanted to bring people together for a big conference, but most people don't have a way to support coming to a conference, and we didn't have the resources to do that. So every fall, we have a virtual convening. You'll see the dates for this year. We have keynote speakers. We have workshops. It actually works very well, and people do it, by phone or at their computer in their own space. So we have a great turnout, and we get staff and parents. So it's really wonderful when you can be involved and you can share that experience with parents, and then you can take that and go off and do your work together with the joint information you've heard. So, and I just, again, more examples of the kind of materials that we have. So whatever we can do to help you, we would love to do that. And, I think I'm going the wrong way. Sorry about that. The final piece is that for the last couple of years, we've been able to do some work to bring birth parents and foster parents together. Again, that's in partnership with Casey Family Programs and Youth Law Center with their Quality Parenting Initiative. And it has been very powerful. We've had parents speaking at national workshops, putting out publications together around, from their collective perspective, what's important for children and families, and why it's so important for foster parents to support the whole family, the birth parent and the children. So again, we invite you to look at our website. I have a list of links here. We're happy to provide whatever support we can for that. Thank you.
So we're going to have all this stuff, and I know people, it's kind of end of the day, so this stuff will be all in your online resources. So you just go to, I think you go to this session, and then you can pull up all the slides. I don't know, is there any questions that are just out there that anybody wants to talk about? No?
I will add that we have a Family Voices United work that we're doing with the birth parents and foster youth, foster club. We're going to be working in 3 states this year.
Yeah.
South Carolina, Ohio,
In Pennsylvania. And that's really an effort. I think what you saw today with the amazing constituents that we had is Casey has put a lot of effort into elevating opportunities for constituents to engage both at a leadership level, at a level, I think now we're trying to encourage folks at a state level where it's already happening. We were trying to take that up to the federal level to help support the components of Family First. We can't really support a legislation, but the components of it. And Family Voices United is really an effort of that same kind of, how do you bring the groups of constituents together, all the constituents that are focused on families? And I think that's what you saw today. And it really, I mean, it's been work that people have been working on for the past year and a half. And I have to say, it's so impactful for everybody in the room, for our young people to see success stories of parents, of kids, and to have those conversations about how do we really look at the whole family and how do we do that work. And Family First is a tool to get us to start moving that way as a system. But anyway, if there's not any other, we'll be posting more information about that, so don't hesitate. Again, like I said, if you want any more information or if you want connections, just connect with whoever you work with at Casey. And if you don't work with anybody at Casey, connect with us, and I'll connect to the people you work that are in your states at Casey and connect you. So with that, I think now people are going back to the main room, but I think there's, just see if the doors are open, because we were all trying to end at around 3:30. Okay, so thank you again for your time, and thanks for coming to the session, and good luck. Keep pushing forward.